We have our vampire facial. We're really excited to go through this. And this is our microneedling plus our PRP. Kelly, we are excited too. All right, so today we'll go over a little introduction as well as a little bit about us. We'll meet the Revive medical team. We're going to go over just 101 basics of vampire facial and answer all your questions, as well as a live treatment. So you guys are actually going to see a live treatment on one of our beautiful models today. And then we'll have Q&A. Make sure to please put your questions in the chat. I do have somebody that's also assisting in answering questions. And then at the end, we'll let you know how to get in touch with us as well as special offers. Hey, Tasha. All right, so this beautiful young lady next to me, Miss Lucille, I'm going to let you introduce yourself.
Okay, thank you. Hi, guys. My name is Lucille Marchand de Samperato. I am one of the nurses here at the Eastlake location for Revive. So I've been in the industry in aesthetics for 3 years. I've been with Revive for 2 years, but prior to that, a major of my career has been in open heart and cardiac ICU in New York City. For me, I specialize in a wide arrangement of aesthetic treatments, especially in regenerative medicine treatment and including microneedling as well. What I specialize in is achieving natural and undetectable results, full facial balancing using biostimulators and hyaluronic acid fillers. And lastly, my favorite is improving overall skin health and quality.
Yes, amen. Then hi everybody, I'm Julie Norton. I'm our VP here at Revive Med Spa. I've been in aesthetics for over 13 years and was a licensed cosmetologist for years prior to going to aesthetics. I've been here at Revive Med Spa for about 2.5 years now and loving it. I have patients always asking, me questions too about what services we do. And it's hard to start with one thing. And I'm always like a very and versus an or person. So I'm always like, you should do all the things, not one thing. And a vampire facial is definitely such a great first step. So for a lot of you that have not done any kind of aesthetics treatments, this treatment is a great first treatment for you as well. So Revive Med Spa, we've been around since 2006. We are the #1 providers for Botox, Juvederm, all Allergan services, as well as cool sculpting. And then we're actually #1 in Morpheus for California. We have 4 locations here in San Diego. We have a new location in our Laguna Niguel location, so Orange County, and then 3 in Northern California. So that totals eight locations. The location that we are in today is actually our Eastlake location, and that is the beautiful photo that you see here. And if you're ever in the area, you should definitely stop by. It is absolutely gorgeous. Oops. Perfect. And this is our medical team. So right in the middle are Dr. Vishal Verma. He's been there since the beginning. He's our co-founder and medical director. Dr. Leif Rogers is another medical director, as well as Dr. Megan Naud. We are definitely led by aesthetic experts in the field. Our medical team is dedicated to identifying suitable surgical and non-surgical options for all of our unique patients and patients' concerns. We are constantly providing advanced trainings to all our amazing medical providers, and so they all have access to the latest technology and techniques. All right, so what we are here for today is all about vampire facials. So what is a vampire facial? And I know it's not just for Halloween, this is year round, but what is a vampire facial?
So what a vampire facial, it is a procedure here. We like to call it as microneedling with PRP. And essentially what PRP is, it's platelet-rich plasma. So what we do as providers, we take your blood and we put it in a centrifuge and we separate your red blood cells and your white blood cells. And what it yields is it creates this liquid gold, and that has growth factors, healing proteins to help stimulate your own natural collagen and elastin production when we do microneedling, the procedure itself.
Love it. Liquid gold. We're going to see some liquid gold today too.
Mm-hmm.
Okay. So microneedling is also a treatment by itself. I know today is about PRP, but when you break it down, what is microneedling?
So microneedling is actually, I would say, one of my favorite treatments to do and to receive as well. It is a minimally invasive treatment. It's a pen, basically, that helps to create micro injuries into the skin, and it helps stimulate your own natural collagen and elastin production for smoother, firmer skin. It can also help with scar tissue remodeling and enhance absorption of topical products. So it helps to improve acne, trauma scars, fine lines and wrinkles, dull, tired skin texture, and pores as well.
Love it. I love microneedling. I've probably done 50 in my my life. So everyone's asking, am I a good candidate for a vampire facial? Am I a good candidate for microneedling? So who would be a good candidate? What's it good for?
A good candidate is anyone over the age of 18, anyone looking for a more youthful look, wanting to enhance their collagen production, and anyone looking for a non-surgical treatment, or anyone that just wants to preserve their youthfulness of their skin.
Hmm. And so before we were talking about that liquid gold, and in this photo, you can see a lot of that liquid gold.
And that's the centrifuge, and that's what we use to separate the red blood cells and the white blood cells to yield the liquid gold.
Love it.
Mhm.
Okay. I don't know how many times patients always ask, like, how long do my results last with treatments? And that's for everything, but it's hard to say. So if someone were to ask you today, how long does the vampire facial last?
Well, each patient is an individual tailored treatment for each patient. Normally, I say results continue to improve up to 6 months and directly after treatment. We always recommend 3 treatments at least, and then doing it 1 month apart. And we go from there, depending if you need maintenance, depending on what your concern is. But it's a
Mhm.
really great treatment.
Mhm. And is this something that you can kind of just always do for like the rest of your life,
A
really? Okay.
100%.
Okay. Yeah. I'm like, if you ever, I always feel like if my skin's just needing a little extra like pep in my step, microneedling is always my go-to.
Mhm.
So, what to expect when they come in? Like, what should a patient know? What did the patient do before their appointment, and what should they expect for during and after?
So before their appointment, they should avoid anti-inflammatory medications such as ibuprofen, drink plenty of water before your appointment. You want to avoid alcohol and coffee. You always want to avoid sun exposure because sun damage, we're trying to reverse sun damage and tanning as well. And when you come to your appointment, we basically apply a topical numbing cream to make your vampire facial or microneedling with PRP more comfortable. And during your appointment, during your facial, you'll be topically numb to manage your discomfort. You may feel some pressure and vibration during the treatment.
Mhm.
And then afterwards, we always go over your aftercare instructions. So we say avoid sweating for at least 24 hours after your treatment. And if you can, try to avoid the sun as much as possible, but after treatment, at least for 2 weeks. And you can wear makeup about 2 days afterwards. Avoid any active ingredients such as retinol after 2 weeks.
Hmm. And the most important part, I think, before your treatment, right, is that water aspect,
Mm-hmm.
because you have to be hydrated before so you can get that liquid gold. And then for like, I know for a lot of patients too, they always ask about sun exposure. Like, can I go right back in the sun after I do my treatment? It's kind of a trick question, right?
It is a trick question. It's like a catch 2020.
Hmm.
I always tell my patients, you can go in the sun, but use sunscreen, use a hat to protect
Yeah.
yourself.
Mhm.
The sun damage has contributed to fine lines and
Mhm.
aging. So you basically want to just do your best to, prevent all that.
Mhm. Absolutely. All right, these are some really amazing before and after photos. So this is PRP and microneedling. What are some of the things that you really see as far as improvement for this patient?
So this patient did microneedling, aka the vampire facial with the PRP. So in her first photo on the left compared to the right side, you can see she has some pigmentation, some dull skin, maybe some like redness as well.
Mhm.
On the right side, she has more of a glow, more highlight around the contour of her cheeks. So that shows me that she has more collagen production. She also has less pigment as well, and I'm assuming she's using really good medical grade skincare products as well. And that's another point we want to bring up is when you pair good medical grade skincare products with your treatment, it's chef's kiss.
Mhm. All right, so we can actually use PRP in other ways. So let's talk. What do you see in this photo?
So we can use PRP in alternative treatments such as for scarring as well. So this patient here on her left, on the photo on the left-hand side, you could see she has a scar on her right around her brow area. So PRP can help with scar remodeling as well. It's all that growth factors and healing proteins that help to stimulate that collagen and elastin of your natural collagen and elastin production.
Mhm.
So on the right-hand side, you see less of the scar and more of your own natural production of skin.
And this kind of shows also for patients that have like acne scarring, because that could be a huge improvement too for any of that.
100%. Microneedling is really great for patients who have acne scars.
All right, PRP for hair as well.
Yes, we definitely love this treatment for hair production as well. So what PRP does, what we would do as providers, we would inject the PRP into the hair and it helps to stimulate hair follicles. So the patient on the top left-hand side, you can see he has about, good amount of hair, but he wants more growth, more production. It's a little bit sparse, but compared to the right-hand side, he has more production of his own hair. And you can even see it in his front and his forehead line as well.
Yeah, that hairline is huge difference. Yeah. Texture too looks super like way improved. So we're gonna let Miss Lucille get to work on our beautiful model. And I'll start, we already have some good questions in the chat, so I'll start with some of that. Let me see here. All right. So some questions are the results less effective for someone that's in their 70s?
It depends. Each patient should have their own individual consultation and see what you're trying to achieve. So I would have to assess, or providers would have to assess and see what your goals are. Microneedling is beneficial for anyone, for any age, for any skin type. But I would definitely make a consultation and see what other treatments you would need as well. And this here is what our liquid gold looks like.
Ooh, wow. That's a good that's some good PRP right there.
So we're going to use this liquid gold as her glide and application. It is a little bit runny because it is, and it's going to be a little loud as well. So Julie will be handing me the questions and I'll be yelling.
Where is the blood drawn from?
It depends. For this patient, normally what I like to do is I like to draw their blood. I'm going to steal your arm right here, right in this anterior cubital area in between here.
And how much blood do you typically have to draw?
Not a lot. I would say 15 mLs, one little tube.
Okay, that's good to know.
So we're going to do one side for Tiffany so you guys could see. And Tiffany, how is your pain level right now?
Good. I'm so numb.
Okay.
We love that. And so for like, say Tiffany specifically for her skin, her goals and I guess Tiffany, what are your skin goals?
I'm looking for a firmer skin, just more youthful looking, glowy. I lost a lot of weight recently, so my skin has definitely seen a big difference in just the elasticity. So this is a really good opportunity to check out how it would, help my skin in that way.
Tiffany, do you mind if I ask how old you are?
I'm 30.
30, okay. Have you done aesthetic treatments before?
No, I haven't. This is the first time. I'm really excited.
Okay, perfect.
So that's awesome.
So yeah, it's great for patients that are just beginning, patients that have also done a lot of other device treatments too. Yeah, like Lucille, wouldn't you say like even if someone's done Morpheus and BBL and Moxie and all the things that this is like a maintenance kind of?
100%. Microneedling is a great way to transition for maintenance after a big procedure like Morpheus. But you can also use it as your yearly maintenance as well. So I don't know if you guys could see, but she's having a really good clinical response to the microneedling, and she's having some minimal blood coming out from her skin. And how's your comfort level right now, Tiffany?
Good, yeah.
Okay.
He's looking like Kente already.
I'm going to turn your head to your left. Very good.
And then how far apart are each treatment?
So for each treatment, I definitely recommend 1 month apart. You yield better results when you do it 1 month apart and keep it close to each other.
And for someone like Tiffany specifically, like her skin type, not a ton of correction, how many treatments would you recommend?
I would definitely recommend for her to do a series, excuse me, to do a series. I would do four, I would do one treatment once a month over 4 months. And then afterwards, it depends what her goal is, but we would talk about her maintenance as well.
And for maintenance on somebody, would you say like 3 times a year?
I normally say if you can quarterly, if you really can, every month is nice too.
And if a patient just did microneedling by itself without like PRP, what would downtime look like? What would like true social downtime look like?
With or with PRP, downtime really looks like you're gonna look and feel sunburn for 3 days, excuse me, for 3 days. And then afterwards, your skin is gonna start to heal, but it'll also start to exfoliate on its own. So I definitely say at least a week.
And then there's like good skincare and things patients can do to kind of help for healing?
Some skincare that I love and recommend is SkinCeuticals. I love the RGN6. It has 6 ingredients that help with fine lines, pigmentation, redness, especially after laser treatments. I also love their epidermal repair. Really great barrier cream for after treatments such as this. And another great medical grade skincare is Plated. So Plated is exosomes. They're shelf stable and they really do help speed up your healing time as well.
These are all products that that patients can grab at Revive, right?
Yes. Okay. All of these are here at all the Revive locations. How are you doing, Tiff?
Good. Whitney's asking, would it work for eyebrows? And Whitney, I'm probably gonna ask you to clarify, do you mean like using PRP injections to help for eyebrow hair growth? To clarify my question, restoration, yes, okay.
Yeah, 100% it can. With conjunction with Plated or exosomes. Anything to stimulate the hair follicle.
Can significant healing occur after microneedling treatment?
I would say, I would definitely say you would definitely feel your skin start to peel on its own. But it's not crazy like a chemical peel. It's really natural. It starts to get like little grainy when you wash your face. Um, but it's rewarding afterwards because you get to start to see the glow and how tight your skin is afterwards. How are we doing, Tiff?
Yeah, feels almost like a tattoo, but like way less.
Have you ever gotten like your lips tattooed or anything before?
No,
Like it feels like.
no, I have one tiny tattoo and it's similar to that, but less painful, definitely.
How does it compare with fillers? Can you do Botox or fillers in conjunction?
Um, I definitely don't recommend doing fillers at the same time. I would wait at least a week or two after a microneedling treatment to do your filler. If you want to do filler prior, you definitely can, and you could wait at least, I would say 2 weeks to 4 weeks, because you want your hyaluronic acid filler to settle in nicely.
Not same day, but absolutely considered.
Mm-hmm.
Okay. And not a norm, right?
Mm-hmm.
How long before the red goes away? And I guess how long would you keep the PRP on too at the same time? Like when would Tiffany wash the face?
So I would tell her keep the PRP, keep the red, the bloodiness on for 24 hours, sleep on a clean pillowcase, because afterwards she's gonna have open wounds or open little micro wounds that were created from the microneedling treatment. So wait at least 24 hours just so her skin could essentially absorb all the good healing nutrients and growth factors and proteins from the PRP.
What other areas can you do microneedling? You can't do your neck, right?
Yeah.
Can you do your decolletage? Yeah, you
We
can do
can
your neck,
Okay.
decolletage, chest. I've done a couple definitely there before.
You could definitely do your neck. I've had a patient do her hands. But it all depends on what area you're looking to do. So I always recommend coming for a consultation. And every patient gets a personalized, tailored treatment towards what their goals are.
How long do you wait before Botox or do Botox first? Oh,
If we do Botox first, I would wait 2 weeks.
mhm.
2 weeks to do your microneedling after.
And then you would do Botox and microneedling on the same day?
We could do microneedling first, and then we could do her Botox after. And then do your nose now.
Yeah, I am gonna drop a photo of myself when I did microneedling just previously. Just a couple months ago. I did day of and I did PRP as well, so you'll see how like red my face is from the actual PRP. Similar to what Tiffany's and that picture of Kim Kardashian that we had earlier in the slide. And then 4 hours later, just to kind of show how much your skin will settle. And then the next morning, after I had washed my face and put on my product. In my healing process, I used plated and RGN6 and I healed probably within 3 to 5 days. So it really significantly helps on downtime and then obviously your results too. Yes, thank you. And you took the photo. So you'll see the photo in the chat. I've heard it helps with dark circles around the eyes. Would you say it is an effective treatment?
I would say it can, but with conjunction with other treatments as well. You really want good skincare. And you can even do PRP for your under eye area as well. We like to combine that treatment as well with your microneedling of the face.
And so if we're doing PRP microneedling, could you use some of the PRP to do some under eye injections?
100%. We could definitely do under eye injections with her microneedling of the face as well.
So that could help a lot with more of the dark circles.
How's your comfort, Tiff?
I definitely feel it now.
Is there any patients that you would recommend not doing PRP or it would be like a constant?
Microneedling is actually great for every skin type. I just always say avoid the sun. Even for our dark skin patients, you want to avoid the sun as well.
Yeah, but no pre-treatment is necessarily sometimes, right? If you're a patient that has a ton of pigmentation or is I guess prone to pigmentation, would you recommend using skincare or products?
100%. Pre-treatment is really good for pigmentation, redness. It's good for during your treatment and after your treatment. Almost done. How are we doing? Good.
The neck is definitely different from the face, but good.
And the vibration, right?
Yeah.
Okay, so we can show you guys what Tiffany looks like. So we only did half of her face and half of her neck. She definitely has some redness on this side. So she'll look and feel sunburn for at least 3 days. And I always recommend using a good moisturizer or barrier cream such as SkinCeuticals RGN6 or their epidermal repair, and then using sunscreen definitely to protect her face, because with microneedling, what it does is it creates micro injuries to the skin, so it's really raw. And when you use the sunscreen, it helps to protect you from pigmentation as well.
Mhm.
Okay.
Yeah.
You did great, Tiffany.
Oh, thank
How do you
you.
feel?
I feel tight.
Tight.
I
Yeah.
feel
The
tight.
therapy kind of like dries, right?
Yeah,
So it
yeah.
feel nice and
Great.
tight.
It's a cool experience. Yeah, like
You
it.
guys can still ask questions in the chat, but otherwise I'm gonna go through our other special offers. All right. All right. Didn't Lucille do a great job? Good job, Lucille. Um, all right. Any other questions and or questions that we can answer for you or Lucille can answer for you? Go ahead and ask now. All right. Well, if you forget, you put them in the chat. And these are all of our social media platforms, our Instagram. So remember, we're gonna announce our special winner tomorrow on our Instagram, as well as you will get a personal email. Our TikTok is here, our Yelp page, our YouTube. So on our YouTube channel, you'll be able to see this virtual event if you want to share it with a friend, as well as all of our other virtual events. Our virtual events, we've done all our regenerative treatments, our multimodality laser devices. We've done filler, facial rebalancing. We've done pretty much anything and everything. We've even talked about GLP-1. Yes, any questions from Whitney? It looks like the under eyebrow was avoided. Would that be a separate treatment?
So for her, I didn't do her under eye area. I'm actually gonna finish her after this, but we're gonna get a little bit closer here. With the
Mhm.
brow area, we don't really go over the hair. We
Mhm.
just stick to around this area, not on the brow, and we try to keep it close around the orbital rim right here.
So would you stay away from the eyelid then, right? You can't go over the eyelid.
Mhm.
Okay. Let's see. Thank you. Thanks, Kelly. Why doesn't her face scar since there was trauma to the skin?
So her
Oh.
face won't scar from trauma of the skin because of the depth of the needle. It's very minimal, invasive, compared to something like like a traumatic injury. So when she heals, she's gonna heal really nicely. We basically with microneedling, we get to a certain degree in the dermis where it helps to stimulate that collagen and elastin production.
Beautiful. Is the face and neck considered one treatment or is it two separate? Kelly, it would be an add-on, but we have some great promotions too right now, so we can always schedule you guys for a consultation. If you would like to schedule a consultation or have somebody give you a call, we will go through our attendees as well and offer our special offers to you guys. So you will be getting a call or email from one of our specialists and they can kind of walk you through, but we do have a promotion right now for our virtual event. That's going to include the PRP as well as 4 microneedling treatments for each treatment. We appreciate everybody. Thanks so much, Kelly, Victoria, Sylvia, for all your questions. We enjoyed today's event. Great job.
Thank you.
Yeah.
Thanks for joining us, guys.
Thank you.